It's very, very clear that we are not moving in the right direction. A question you can ask yourself is, in the last week or even the last few days, how many people have you been in contact with outside of your house?
The Message Wednesday, direct and clear from our province's top doctor. We are in a serious situation in Manitoba. And home is where we should all be right now as much as possible and for the foreseeable future.
Right now, today, we can all put measures into place to protect us, to protect the people around us, to protect our community, protect our healthcare workers.
The numbers Wednesday clearly showing the urgency. 170 new cases, the active count well over 2,300 now, both dominated by Winnipeg, while hospitalizations and ICU admissions rose yet again, and 3 more Manitobans have been lost.
A male in his 80s from Winnipeg linked to a Victoria Hospital outbreak. A female in her 80s, both from Interlake Eastern, linked to Misericordia Place outbreak, and a male in his 40s from Interlake Eastern.
Rusin says the message about Thanksgiving gatherings was clearly not received, and that impact is now hitting home hard.
You've heard of 7 cases related to just a single gathering. And there's probably many more to come from that gathering, and there's many more such gatherings that have cases.
And the spread expanding quickly, which could result in Winnipeg moving to the highest level of COVID response in the days ahead.
We see now that transmission occurring through all age cohorts. We're seeing that into high-risk settings. And so if this trend continues, we'll continue to see that strain on the healthcare system. So we will need to act.
The impact on higher risk settings has raised questions about the care at Rivera-run homes in Winnipeg. As Parkview Place, Heritage Lodge, and Maples, all Rivera properties are dealing with outbreaks that have resulted in over 20 deaths between them. But Rusin says there are no plans to take over any of these facilities.
It's not just a simple matter of just walking in and taking over care. It's a matter of ensuring that all of the recommendations of infection prevention and control experts, all of the regional recommendations are being adhered to. That's the main issue.
Rusin says Rivera is working with the WRHA and is acting on recommendations. The impact of the cases there will be directly impacted by another front in this fight, the capacity of our health system, which is reaching a tipping point. In Winnipeg, Jonas Gilbart, City News.